Hey guys, it's J. Michael Bennett here, and I'm over at Plex, which is an excellent physical therapy facility where they do sports performance, sports-specific training. And I'm just here to show you some basic exercises on what to do after surgery. Primarily, this is geared towards my patients that have had any kind of shoulder surgery. Once again, this is every surgeon is different regarding their post-operative course and the rehabilitation, so it's very important that you follow what works for your surgeon, okay? You do not want to go outside of their specific directions. One other exercise you can do to get your internal rotation is when you reach behind your back, is when you take a shower in the morning, basically when you're done with the shower, you take a towel behind your back. You basically take a towel behind your back, and this is kind of a back drying technique. And this is the operative side, but you want to get your internal rotation. You want to work on this motion here. So you take your towel, and it's like you're drying your back. You're holding your towel on either side here, and then you're slowly pulling up and holding it for a count of 10, and then you drop it. Pull up, hold it for a count of 10, and then you drop it. Okay, and that will give you your internal rotation, actually help you reach behind your back. And like I said before, I do not recommend doing this for any kind of tendon repairs, any type of fixation that you've had in the shoulder. Typically, this is just for patients that have had a bursiectomy or manipulation under anesthesia, or have had some sort of contraction release in the shoulder. It's not necessarily recommended this early on in rotator cuff repairs. Usually later on, after the tendon has started to heal, usually in my patients, I'll start this like around at 8 weeks or so. We'll start really pushing the motion a little bit higher and harder, but I will wait until later on down the road to start these type of motion exercises if you've had a rotator cuff repair. Like I said before, it all depends on your surgeon. You all have a different protocol. Check with your surgeon first before you do any of these exercises. For these exercises, a lot of times I recommend, particularly with wall walkers and the internal rotators, those are great to do in the morning when you take a hot shower. It warms up the arm a little bit, gets things loosened up a little bit. And as far as reps are concerned, you can do, usually I recommend doing it in the morning and the evening, probably a set of 10 in each direction. Hold it for a count of 10 seconds at each point at the apex, and that should be good enough unless your surgeon has any particular other type of protocol they want you to follow.